Hi, my name is Camille Mioka, and I'm here to talk about my 5 medical conditions for our project for this course. I will begin by talking about medical condition number 1 is in chapter 4, and I'm going to just be talking about eczema. And this picture is basically saying where all the common sites of eczema outbreaks are in patients from babies to adults. Most common areas are, as you can see, in the hands and forearms, the chest area, the cheeks for kids, and kind of the back of the heads in kids, and feet, and the back of your calf muscles. And then in adults, it's quite similar, but more spaced out. So kind of on your neck, on your hands, in between your elbows, and then the back of your hands and then the back of your knees. And the anatomy affected by eczema. Eczema affects the stratum corneum epidermis, which is the first layer of our skin. Our stratum corneum layer is the layer that protects our skin and body from germs. Since our corneal layer doesn't provide enough protection, it is easy to get damaged by inflammatory response occurring in the skin. Another possible cause is a mutated gene as well. So this is a picture of healthy skin and skin that is affected by eczema. It says healthy skin on the number 1 on the left side. You can see it's very normal looking, and then on the right side you can see a little just stuff that's in there, and it says acute. The rash begins to form. Skin becomes red and is itchy and very blistery. And then in the bottom left, it says subacute, which means transition from acute to chronic. The rash stings and starts to flake. And then on the right, bottom right, it says chronic itching resumes, skin cracks and toughens. Topical steroids and ointments are used to ease irritation, which I will talk more about when I talk about the treatments for eczema. The effects on the body system. So it can lead to bacteria such as staph infection, causing eczema to spread and get worse. Inflamed, cracked skin can make it easier for herpes virus that you can get as well. Scratching your body can lead to wounds on the skin that may become infected. Allergic eczema may be associated with hay fever or asthma. For leading to bacteria such as staph infection, if the infection spreads, then antibiotics will need to be used for treatment. And then when your skin is inflamed and cracked, when your stratus corneum isn't providing protection from harmful diseases, that's when the herpes virus could become more easier for people to catch. And then for scratching your body, I would just try hard to not itch. I know it's easier said than done, especially for children. I would suggest cutting your children's nails as good as you can so they can prevent from open wounds to happen. And then it said about 1/3 of all children who have eczema also develop asthma or hay fever by the time they turn 5. And so diagnosis, physical exams are given. If a dermatologist, for example, which are medical doctors that are specified in skin diagnosis. And so if you have an itchy rash on parts of your body that are typical for eczema and it lasts or keeps coming back for several months, then usually a doctor will diagnose you with eczema. Or they have allergy tests. A test is done by either testing their blood or doing a skin prick test. The blood is tested for specific antibodies that the body produces in response to allergens. So treatments and procedures that they can do. Basic treatment is a lipid replenishing and moisturizing products are applied to the skin twice a day to keep it from drying out. This can help relieve the itching. Special soaps, liquid cleaners, and shampoos. Steroid creams relieves the inflammation and itching. Others include wet wraps, UV radiation, and medications that suppress certain immune responses. Dermatologist would be the best medical specialist to go to, like I was saying before. Okay, my medical condition number 2 I picked was tuberculosis, short for TB. I'll just give a brief overview. It's a disease caused by bacteria that are spread through the air from person to person. If not treated on time and properly, TB, tuberculosis disease, can be fatal. Need to be treated immediately. Someone in the world is newly infected with TB billiculi every second. So it's very common and it can happen to a lot of people easily. And then overall, 1/3 of the world's population is currently infected with TB billiculus. So it is. And then I have this picture on here, and it says, "What is tuberculosis of the lungs?" It's basically just giving an overview and kind of shows where that bacteria gets put in your lungs and shows a little histology image of the bacteria too. So the anatomy affected by TB. TB is commonly present as a disease of the lungs. The infection can spread to all organs in the body if it becomes severe. You develop TB in the pleura, which is inside your lungs. It's the covering of the lungs, excuse me. And it also it develops in bones, urinary tract, sexual organs, intestines, and your skin. TB diagnosis. You can go to your local medical doctor, family doctor, and they can check your lymph nodes for swelling. That's what they usually first do. And then they could also use a stethoscope to listen to the sounds your lungs make when you take deep breaths. And then there's also a skin test. A small amount of substance called PBD, tuberculin, is injected just below the skin of your inside forearm. And then after 48 hours, you have to come back, and if there's a raised bump, that means you're likely to have TB infection. And then there's also blood tests. These tests use sophisticated technology to measure your immune system reaction to TB bacteria. And then there's x-rays. If you have a positive skin test, your doctor is likely to order a chest x-ray to take a closer look at white spots in your lungs where your immune system has whaled off TB bacteria. And then sputum tests. If your chest x-ray shows signs of tuberculosis, then the doctor will take samples of your sputum, which is the mucus that comes up when you cough. This helps your doctor determine what medication he or she should prescribe to you. And then for treatments, there's medication, which is most common, and all these 4 medications are the ones that are most common for TB patients. So Isoniazid is a medication, Rifapentine, Elaputin, and pyazidamide. TB takes much longer than treating other types of bacterial infections. Take antibiotics for at least 6 to 9 months. Completing treatment is essential. Okay, and then my number 3 is endometriosis. It's a painful disorder in which tissue that normally lines the inside of the uterus grows outside your uterus. Most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. So this is a picture of a woman's fallopian tubes and her uterus, and you can see on the fallopian tubes, you can see the endometriosis forming on the sides there. That's what causes the painfulness. The effects on the body: it displaces of tissue, has no way to exit your body. It becomes trapped. Endometriosis involves the ovary cyst form called endometriomas. Surrounding tissue can become irritated, developing scar tissue and adhesions, causes pain, can be very severe, especially during your menstrual cycle. Symptoms and diagnosis of endometriosis is, very, very, very painful periods. Pelvic pain and cramping may begin before your period and last several days. Pain with intercourse, pain with bowel movements, and infertility. Diagnosis is A pelvic exam manually feels for cysts on your reproductive organs or scars behind your uterus. Ultrasound capturing images to see if you have cysts in your reproductive system. Treatment for endometriosis is pain medication. A doctor may recommend to take anti-inflammatory drugs to help ease the pain. If not working, then try a different approach. There's hormone therapy. Supplemental hormones are sometimes effective if reducing pain of endometriosis, like birth control, hormone contraceptives. Conservative surgery is removing as much endometriosis as possible. Another thing, the rise and fall of hormones during the menstrual cycle cause endometrial implants to thicken, break down, and bleed. Hormone medication may slow endometrial tissue growth and prevent new implants of endometrial tissue. And then your doctor may do this procedure laparoscopically or through traditional abdominal surgery in more extensive cases. In laparoscopic surgery, your surgeon inserts a slender viewing instrument called a laparoscope through a small incision near your navel and inserts instruments to remove endometrial tissue through another small incision. So my number 4 medical disease is ectopic pregnancy. And a little overview for you guys is ectopic pregnancy occurs when a fertilized egg implants somewhere other than the main cavity of the uterus. Often occurs in one of the tubes that carry eggs from the ovaries to the uterus. Ectopic pregnancy can't proceed normally. Effects on the body. So the egg cannot survive. The growing of the egg may be destroyed or may destroy tissue and maternal structure, causing it very difficult to get pregnant again. So this is a picture of, so the top one is a normal pregnancy where the fertilized egg is implanted in the uterus. And then on the bottom one, it's a fertilized egg implanted in the fallopian tube, and that's where when the baby starts to grow and grow, it'll burst your fallopian tube, and that's what will cause a lot of issues in your pregnancy and leads to termination of your baby. Your medical specialist, OBGYN, would do a pelvic exam for diagnosis, checking for pain, tenderness, or a mass in the fallopian tube or ovary. Usually isn't enough to diagnose an ectopic pregnancy, so they will need to do an ultrasound, which is an imaging way to see or detect the pregnancy through, which is an ultrasound. And then blood tests can confirm emergency situation. Surgery would take place to remove the ectopic pregnancy if you're in severe pain and the doctors think that's the reason. So treatments and procedures for ectopic pregnancy. Ectopic tissue needs to be removed surgically. If detected early enough, an injection of the drug methotrexate is sometimes used to stop cell growth. Emergency situation, like I said, usually treated with laparoscopic surgery, which is a small incision made in the abdomen. Like I said before, the doctor uses a thin tube equipped with a camera lens and light to view the area. If fallopian tube is severely damaged, then it may need to be removed. Okay, this brings me to my last medical term that I'm going to be talking with you guys about, and I'm talking about intracranial hematoma. And the overview of this is hematoma is a collection of blood outside of a blood vessel. There are several types of hematomas based on their location in the body. For instance, intracranial hematoma refers to a collection of blood inside the skull. Most common by rupture of blood cells. Blood collections can be in the brain tissue or under the skull, creating pressure into the brain. And let's see here. Here is a picture of intracranial hematomas. So A is an epidural hematoma, and an epidural hematoma is an accumulation of blood from the temporal artery between the dura and the skull. And then in picture B is an intracranial hematoma. which I'm talking about